and Rachel too. Time now to ask the expert. Here to answer your questions live on the air is Vice President of One Medical, Dr. Natasha Bhuyan. All right, our first one, Mike in Phoenix. What is the gut microbiome? Excellent question.
Yes,
what is it?
I mentioned it earlier. This is a hot topic in medicine. So our gut microbiome, our gut is made up of lots of different microflora. So that's bacteria, viruses, fungus, and it's all in a perfect balance.
Yes.
Lots of things can throw off that balance. So if you take things like antibiotics, it wipes out all the bad bacteria, but also good bacteria with it. If you're eating lots of ultra-processed foods. And so when our gut microbiome is out of balance, it actually can impact our health in lots of different ways. We are learning that the gut can impact mental health, so it might cause things like depression. We're also seeing a link to chronic diseases, and now we're seeing a link to cancer as well. So that gut microbiome is really important. Lots of factors that influence it, as well as environmental factors, even things like cleaning products. And so hot topic in medicine, we are learning more about this every single day.
So should you be eating that? Does that go back to the healthy foods?
Yeah,
and like
yes.
Lots of plants.
It's really this idea of how do we make sure that our gut microbiome is staying in that perfect balance that we need to stay it in with the healthy diet.
Wow. Okay. Good question. Okay. Next one. I am a 78-year-old female. When should I stop having mammograms and getting a colonoscopy?
Yeah, and that's a great question. So there are guidelines on this, and so it's a good thing to talk to your individual PCP about. There's guidelines on exactly when we should stop, in our 70s, but it also really depends on a person's own individual risk factors and their own, appetite for doing this testing, when exactly that should stop. But we generally say in your 70s you can stop.
Okay.
But it just depends on your overall health picture. So I would say talk to your PCP.
Always double check when in doubt. Okay, Rebecca from Surprise. There are a lot of supplements. Some are cheap and I can get it on Amazon. Others are in the refrigerated section at the store and are $50 to $60 a bottle or more. Do any of these work?
Okay.
I love this question.
Supplements for the prevention of cancer. There's been a lot of research on this, and they actually don't work in preventing cancer. We're doing more and more research on this, but people ask every day, should I take vitamins or supplements? And we're not finding a link to preventing cancer. That being said, when people are undergoing active cancer treatment, there are times that their cancer doctor, their oncologist will recommend that they take supplements in addition to their cancer treatment. But just taking supplements to prevent cancer has not been effective.
Okay. Is there a difference? I always wonder this, like the cheap ones versus the refrigerated ones.
Yeah, so sometimes the refrigerated ones are often probiotics that are live strains. And so it's live culture and live bacteria. And so that's why it's more expensive. And then there's the cheaper ones that are dry. They often have shown that they're both effective. What really matters is actually how many parts per billion you actually have. So what's the quantity of that strain?
You know what? You just gave me another segment idea. We should do a story on that stuff. Okay, so Linda from Chandler says, what is genetic testing for cancer risk? Is this something people should consider?
Yeah, so there's a couple types of genetic testing. So there's at-home genetic testing, and then there's genetic testing that you can get through a counselor. The at-home genetic testing is pretty widespread, but what we've found is it's not super effective for determining cancer risk, because what we're looking for is mutations in certain genes, and the at-home tests, they don't test all the different mutations that you could possibly find. I think the at-home testing is great for looking at your ancestry, learning about your family history, but if you're really concerned about your cancer risk and you have a family history of cancer, you've got some relatives with cancer, you see clusters of cancer in your family, it's best to see a genetic counselor and they can determine exactly which genes you should get tested and which mutations we're looking for. It's highly specific.
Yeah, no kidding. All right, great information. Natasha, thank you. And let's work on that probiotics segment.
Yeah, that's a great idea.